Leave this on my lap, or
Yeah, you can leave that on your lap.
you're not gonna see it?
It's cut off right around
Here?
here. Okay, we're ready. Go ahead when you're ready.
Okay. Please tell me your name and title.
Janet Nguyen, State Senator of the 34th Senate District.
What is your relationship with COCC and how did you become involved with the consortia?
So my relationship with the community clinics members and many of the clinics has spanned over a decade. We worked on many projects together, whether it is in partnership with helping community members and residents in getting health care, preventive care, and or helping also working in legislation as well. And so we've spun over a decade of relationship and either helping directly with residents and getting them the preventive care they need, or doing legislation. That one of the ideas that we've tried this year was to increase volunteer hours for providers, because they give so generously to the clinics, and the clinic depends on these providers to care. Without their time and their efforts, we won't have the clinic open, and the hours and times of the clinic has been very helpful to members of the communities to be able to come and get help for not only for themselves, but also their family and their children as well.
So based on that question, what kind of value does this provide to your community?
Hold on.
Go ahead,
What?
don't worry.
So the value that the community clinics have given and can provide to the community is, one is they're the fabric of our community. They're there when members of the community needs help, whether that is healthcare. They also provide food pantry. They provide directions to government services or community services that the members need that day. For their family or children, so they are there. They're the foot soldiers, the boots, on the ground that helps our community in whatever needs that's needed. Whether that is a toothache today, getting vaccination, getting flu vaccination, needing some food, needing some assistance, whether it is to contact the government for housing, other related matters. The community clinic is there to assist.
Please talk about COCC member clinics in terms of being a key partner in the community to deliver services to safety net populations.
The community clinic has been that fabric to deliver direct health care. Not only that they have availability of their clinics throughout the community, but they also have mobile clinics as well. And those mobile clinics are so critical because some of the members of our community don't have access to getting transportation to the clinics. And some might be afraid or might not know. And so a lot of the mobile clinics go directly to the community, to the apartment complex area, to the community centers, senior centers, or wherever it is, to the schools to provide direct care and examination for our kids, for the parents, for our grandparents, whatever it is. They go directly if their family can't come to them. And so it is extremely needed. And what they provide has been so essential and so important to our well-being of our community members.
Can you describe in your own words the work that member clinics perform in their communities?
The performance of the clinics and their staff are above and beyond. They're compassionate. They are friendly. I've worked with them for over a decade, and I've not seen one time where they've said no to anybody. They'll find a solution, but they make people feel welcome. Because, I came from a family when we came to this country, we were very poor, and we needed assistance from clinics, from nonprofits. And when you're you're at a point in your life where you need that help, sometimes you just need someone just to have a smile to help you. And so they always have a smile and always willing to help and be so friendly. It makes people not remember the situation they're in at that moment, but it gives them the pride that they are at that moment instead. And so I think it's important because the value that the clinics and the staff and their volunteers gives is above and beyond, not just caring, but they do it with such compassion and such love that people walk away with a smile and not feel, oh, I shouldn't have come there, or that, oh, how did I get myself in this situation to have to ask for service? And so, you know, for what they do, I want to thank you because it's not easy what they do. And a lot of these stories are so difficult to hear that it is painful for me even to hear about some of these situations. And it's hard for us to just put a smile, even though we know how difficult it is for these individuals. But by putting that smile and that love and that eyes that they can see that cares for them, it goes a long way.
What type of patients do they serve?
Okay. The types of patient the community clinic serves, it really depends on the clinic. It's a very niche, clientele. It depends on the clinic. Some clinic, serves in a particular neighborhood, whether that could be particularly that neighborhood or maybe if that neighborhood has a lot of, say, Vietnamese Americans or a lot of Latino, they'll have staff that will be able to communicate in those languages for those individuals. Or, they could also, I've seen where they've worked with children, specifically for, eye vision or, dental cleaning and care, because a lot of times, the success of a child is correlated with their health care as well. And there's lots of other clinics that also aim to help with mental health issues or homeless issues. So it really varies depending on which clinic and where they are based and their particular, foundation and what they thrive for in their mission statement. And so, from our experience, I've seen is the clinics we've worked with has helped anybody who can walk into the door. They've never said no. And so if they can't do it there at that clinic, they'll pick up the call for another clinic or for another organizations to assist. But it just really depends on what their mission statement is.
Last two questions. What are politicians in Sacramento or Washington, D.C. missing about COCC and other community clinics consortium?
So one of my main goal as a member of the state legislature has been a couple things. One is to increase the provider reimbursement rates. It is very important that for every penny that we spend on community clinics and preventive care, the better it is for us overall in costs. But it's also better for our community in general. And so we have to work on and continue to have that discussion of increasing reimbursement rates and also looking at certain care that is not even part of reimbursement that was cut when the recession hit. The other part is we need to have the discussion of preventive care. Preventive care is so important. As I mentioned before, is that preventive care, a child's success depends on how they feel health-wise. If they can't see, they're going to be the student who'll be too embarrassed not to tell others that they can see in class, and they'll be the one in the back. And if they can't see what the teacher's writing, then they're not going to be able to have a successful, time in school. And they're going to fall through the cracks. And a lot of young children don't understand what a toothache is. They wouldn't know what that means. They would think it's normal, and it's not. And so preventive care helps, starting with children, is get them into a healthy state for them, for their future success, but also it also at the end of the day saves us more money as a government agency if our members of our community are healthy. And that goes with adults as well. You know, we've always encouraged flu vaccination for children, those who care for children, and those who care for the elders and the elders, because those are the population that tends to be the one in most danger when it comes to getting sick with the flu and actually end up in the hospital or potential death as well. And so those preventive care and taking care of ourselves and making sure that we're healthy, because without health, there's no life. And without life, there's no family. And so we want to make sure that our health and preventive care of that, and understanding every step of your own health care is important. And so we need to continue that discussion, is increase the reimbursement rates, making sure that things that were cut in terms of reimbursement and services in the past should be restored. And on top of that is continue to have that discussion and have that preventive care. Encourage people to go to the dentist annually, encouraging people to do the checkup. Don't wait until you have to end up in the hospital. And that's when not only the costs go up, but more importantly, your health is more in danger than it was 2 weeks ago, 3 months ago, had you just went to the doctor. And so that's where we need to continue those discussions in the state level and federally as well.
Okay, last question. Can you talk about the funding bang for the buck that health centers provide?
The clinics itself is where the community goes to versus directly to the hospital. And that cost to the hospital 10 times, 100 times more versus getting the care immediately. So versus having to go and wait until you need that surgery, you could have helped prevented that. And that's where the clinics bang for the buck means, is that for every dollar the clinic provides, it saves thousands of dollars overall for that one individual. And so we need the clinics. We need them to continue their services for our community members who need access to healthcare and just to be there for them as a community. And so their leadership and their support and services is very essential to our overall well-being of our community.
Cut.
Okay.